My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider. Hi, this is Dr. Frank with My Doctor Said What? Today we're going to be talking about a complex subject, dementia. But before that, a couple of fast facts. In my podcast last week, I talked about cancer. And cancer is a series of over 200 different diseases that have in common that they have unregulated cell growth. But I forgot to mention a couple things. Metastasis. When they say it has metastasized, it means it's spread from one tissue type to another. If you have breast cancer and it metastasizes to the lung, then it's those same unregulated, uncontrolled growth cells moved into the lung. So as long as it's confined in one tissue, it's much more treatable. It becomes a little more difficult when it's metastasized, goes throughout the body. It basically spreads. Another thing I may have glossed over is one thing that can cause cancers is certain viruses like HPV, human papilloma virus. And there's vaccinations for those when you're young. 90+% of the U.S. population has HPV, so it's transmitted sexually, and it over a long latency or long period of waiting, it activates and can become certain cancers in the genitalia, etc. So those are things that I think are important to mention. With that, we'll go into dementia. Dementia is not a specific disease. It's a general term for your impaired ability to remember, think, or make decisions. And it is not a part of normal aging, just so you know. That is not normal. Little forgetfulness here or there, forget your keys, forget a recent event, can't come up with a name of someone that you've not met long ago. That's just a part of cognitive decline, not a part of dementia. 10% of the population over 65 has some form of dementia. So just so you know, it's not super widespread. We hear a lot about it, but it's in 90% of the population, it's not an issue. When you get in your upper 80s, if you're fortunate enough to live that long, then you can see some declines from changes in brain chemistry. So again, what are the signs and symptoms? Your memory becomes, especially your long-term memory, has issues. Your attention, for us attention deficit people from birth, that's hard to believe, but your attention span can change. Your communication changes. You have problems with words. Your reasoning, judgment, and problem solving are difficult. That's why it's nice when people do Sudoku or puzzles or crossword puzzles or something that actively engages your mind. That's a great thing because it keeps it sharp, and it also gives you a measure if you're seeing you start having difficulties. So visual perception can change, and hopefully you have a ophthalmologist that you see once every year or two in addition to your normal physicals, and they can tell you if it's related to other eye diseases or it can be part of dementia. So signs that you have dementia: you get lost in a familiar neighborhood, you start using unusual words for familiar objects, you forget the name of a close family member or longtime friend, you start forgetting old, distant memories. So with that, what increases the risk for dementia? Age, we know that. It causes disease states almost in everything. As you age, cells get older, the telomeres in the cell get shorter, and that's just part of aging. Family history. If you have parents or siblings that had some form of true dementia, and you have to be careful. A lot of people have no clue what their family history is. They heard this or that from Aunt Betty. That's if you know they have a family history that's a close relative, then you're more likely. African Americans are twice as likely. Hispanics are 1.5 times more likely than Caucasians to get dementia. Poor health, high blood pressure, damages all kinds of tissue, including brain tissue. High cholesterol, same thing, can damage tissue, including brain tissue. Smoking increases the risk of dementia proportionally, as with almost everything else. Traumatic brain injury, concussions like little league and big league football players get, or lacrosse or soccer or whatever. When you have bad car accident, you have to be careful. Traumatic brain injury can do damage that can lead to long-term dementia. How do you diagnose it? Your healthcare provider can do certain tests with memory, problem solving, and other cognitive functions, and then they'll do physical exam with blood tests, brain scans, potentially CT and MRIs to determine the underlying cause. But their cognitive test, the test of your learning, memory, and ability, will determine if you have dementia, scaled test, or if you're just having, typical short-term lapses of memory. What's the most common kinds of dementia? The one you hear about the most is definitely Alzheimer's. And that's about 60 to 80% of the cases. It's accumulation of aluminum in the brain. We don't know exactly why it happens, but we know that you can even start having difficulties with walking and then swallowing. Personality changes come in the later stages. So it's a disease that takes a certain amount of time, different in different people, to develop, but that's the one you hear about the most. Vascular dementia. My father had vascular dementia. He had a series of mini strokes, and he rapidly declined in his ability to remember things and then to speak and then to swallow, which ultimately led to his death in a relatively short time, 9 months. And he was 80, almost 7 years old. So you have to be careful if you've had a stroke, especially if you have these little mini strokes that you may not recognize. If you start having those issues, you need to see your healthcare provider right away, because there's several preventative and treatment steps that can help you tremendously in it. Lewy body dementia, that's a different, it's a specific type of body, cellular body in the brain, proteins that cause Lewy body dementia. So that is fairly rare, but that has a lot of stiffness with it and some trembling. So kind of mimics Parkinson's a little bit, but it's not Parkinson's. So they have trouble sleeping too. So, and they might have visual hallucinations. So your healthcare provider can diagnose these. I'm just giving this for your information. Frontal temporal dementia is changes in personality and behavior, and really inappropriate behavior. Somebody that's very calm and collected all of a sudden has great outbursts, and that you need to have that checked out as one possibility. There can be some issues with that type of dementia, how it affects the brain. Too complicated to get into here, but that's another type. Mixed dementias, where you have several different types. It's kind of like getting the cold and the flu at the same time, except you can have Alzheimer and vascular dementia at the same time if you have strokes. There are some reversible causes, such as side effects of medications. Certain medications can cause you to have temporary dementia that can be fixed because you have increased. You can have an increased pressure in the brain from some types of events, such as trauma, that can be relieved. Certain vitamin deficiencies, believe it or not, can cause temporary dementia. And thyroid hormone imbalance can cause temporary dementias. Those can be screened for, and they're reversible causes. So that's good news. Never panic never panic, period. But make sure you get a thorough and proper diagnosis. And different types of dementias, again, are like the common cold or cancer, in that there are multiple causes, multiple outcomes, multiple treatments, and you need to really carefully consider with your healthcare provider. And definitely you'll want to go to a neurologist recommended by your healthcare provider if you have any symptoms that they believe may be related to some type of dementia. So again, there's different things we have to look at. There's no cure for something like Alzheimer, but we're making a lot of progress. So support your Alzheimer Foundation. Make sure you get accurate diagnosis and a medical assessment. A couple other things I want to tell you that reduce your risk for Alzheimer that are easy. Diet and exercise, those that eat a lot of fish, fruits, vegetables, and oils. Exercise and do cognitive training, like I said, Sudoku or crosswords or anything that involves your mind in an interactive way, involves your memory. Find that those things can really help reduce your chances of having dementia. Alcohol, minimize or abstain from, can really help. Definitely long-term drinking has a neurological effects that can lead to dementia. Obesity, high blood pressure, high cholesterol, buildups of fat in the artery walls, arteriosclerosis. That's going to lead to damage a lot of times in the brain and can lead to dementia that could be controlled. The same way with smoking. If you quit smoking, you'll really reduce your chances of dementia, believe it or not. Depression. Don't understand it very well, but recent research says depression can have effects that can cause long-term, can cause an increased risk of dementia. Air pollution, can you believe this? Can speed degeneration of the nervous systems. And they've found particularly traffic exhaust and burning wood that you smell on a frequent basis, certain types, can cause increased chance of dementia. We talked about head trauma. Head trauma can always be an issue. And if you're over 50 and have traumatic brain injury, you have a much greater chance of dementia. Sleep problems. If you have sleep apnea, have it treated. It's bad in a lot of ways, from a cardiac standpoint, as well as a dementia standpoint, as well as anxiety, etc. So you need to have that treated. You want to make sure you get a good night's sleep. It's when your body can really recover, and that's important. There are certain infections that can cause an endocrine problems. We talked about thyroid, low levels of B6, B12, copper, vitamin E, not drinking enough liquids such as dehydration can cause dementia-like symptoms. So be careful. Certain medications you have to talk to your doctor. You certainly don't want to have any bleeding and brain bleeds. If you've had a fall or something, older people, you need to be checked out by your healthcare provider. Rare, but brain tumors can cause dementia, even if they're successfully removed or shrunk because they damage tissue. And so you want to make sure that you look at these things and you're careful. Have a great day. You can find my podcast on all major platforms. This is Dr. Frank. Have a great day. Today we're going to talk about dementia. Today we're going to talk about dementia. Just kidding. And it's not something to kid about. But part of the problem is you don't want to be depressed. So enjoy yourself. Have a stress-free life. Sleep well. Laugh a lot. And Dr. Frank will see you on My Doctor Said What next time. Have a great day. Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.